If you want awesome products at great prices, check out the in the description. The crumbling foundation of public health. How the dismantling of the CDC's STI lab fuels a public health crisis. The recent, chaotic cuts imposed by the Trump administration on the Centers for Disease Control and Prevention, CDC, have sent shockwaves through the public health system, particularly impacting the crucial research, surveillance, and testing programs for sexually transmitted infections, STIs. The closure of a dedicated STI lab, resulting in the layoff of all 28 employees, represents a devastating blow, occurring amidst a concerning resurgence of STIs, most notably syphilis. This action is not an isolated incident, but rather a symptom of a broader, alarming trend of undermining expert leadership and vital public health initiatives. The consequences of these cuts are already manifesting in stark realities. Wisconsin, for example, has witnessed a staggering 1,450% increase in syphilis cases since 2019, a trend mirroring a nationwide epidemic the CDC itself termed heartbreaking just 2 years prior. The rise of congenital syphilis, a preventable yet devastating infection transmitted from mother to fetus, further underscores the gravity of the situation. Even a single case of congenital syphilis serves as a damning indictment of our failing public health infrastructure, given its easily treatable nature with a single dose of antibiotics. This crisis unfolds against a backdrop of years of insufficient public health funding, leaving the U.S. with some of the highest STI rates among developed nations for chlamydia, gonorrhea, HIV, and syphilis. While recent data shows a slight decrease in gonorrhea and stable chlamydia rates, according to a 2023 CDC report, and a 12% decrease in new HIV infections between 2018 and 2022 thanks to new government support implemented during Trump's first term, the progress is fragile and vulnerable to further setbacks. This vulnerability is precisely what the recent cuts exacerbate. Trump's pledge to eliminate HIV, made during his 2019 State of the Union address, rings hollow in the face of these actions, actively undermining the very mechanisms designed to achieve that goal. The abrupt dismissal of all 28 employees from the specialized STI lab on April 1st, alongside approximately 10,000 other CDC employees as part of Health Secretary Robert F. Kennedy Jr.'s sweeping cuts, has left a gaping void in critical STI research and surveillance. Dr. Marazzo, a key figure in STI research, was placed on administrative leave, highlighting the silencing of expert voices within the public health sector. Her comments underscore the desperate need for advancements in STI diagnostics and treatment. "We've made commitments to things we can't back down on, and STIs are a great example," she stated. "One of the most frustrating aspects of syphilis in the field is making a diagnosis of active syphilis and then monitoring the response to therapy, so we desperately need new diagnostics." The lab's closure has far-reaching implications beyond syphilis. It played a critical role in investigating antimicrobial-resistant gonorrhea, a growing global threat. Currently, ceftriaxone is the only reliably effective antibiotic for gonorrhea treatment, and the emergence of resistant strains, while still rare, is a significant concern, monitored by only a handful of labs worldwide, including the now-defunct CDC lab, which collaborated with the World Health Organization, WHO. Trump's early move to withdraw from the WHO further complicates the international collaboration essential for tackling global health threats. The fate of the lab's 50,000 samples of gonorrhea isolates remains uncertain, raising serious questions about the preservation of invaluable research material. A former CDC employee, speaking anonymously for fear of retribution, expressed grave concerns. "They're irreplaceable," they told Stat News. "Are they just going to autoclave the whole thing and destroy it?" This chilling prospect highlights the potential irreversible loss of crucial data and research resources, undermining years of scientific progress. The ramifications extend far beyond the immediate impact on research and surveillance. The elimination of expertise and resources at the CDC will have a cascading effect, hindering prevention efforts, delaying diagnoses, and potentially leading to more severe health outcomes. The chaotic nature of these cuts, coupled with the dismissal of essential personnel, suggests a deliberate dismantling of vital public health infrastructure. The consequences of these actions will be felt for years to come, potentially leading to a surge in preventable diseases and exacerbating existing health disparities, particularly impacting marginalized communities disproportionately affected by STIs. The situation demands immediate attention and reversal of these damaging policies to safeguard public health and prevent further deterioration of the nation's ability to respond effectively to infectious disease outbreaks. The long-term cost of inaction will far outweigh any perceived short-term savings. This crisis calls for a complete reevaluation of public health funding priorities and a recommitment to evidence-based policies to protect the well-being of all Americans.